There are millions of individuals whose lives have been shattered, either due to a sudden accident or an unfortunate illness. Many of them have lost the ability to communicate, either temporarily or permanently. My name is François Guern. I am the founder and CEO of Neuro. And at Neuro, we aim to change that. The largest group of individuals that we define as touchless and voiceless is stroke victims. Stroke victims have a common denominator. They have aphasia, or the inability to speak correctly, and they have upper limb weakness or paralysis. As you can see in this picture, stroke can bring an individual to such a diminishing point that life no longer matters. The World Health Organization indicates that 17 million new strokes will happen this year worldwide. That's one new first-time stroke every 2 seconds. We estimate that 33% of these individuals will become touchless and voiceless. At Neuro, we have realized that certain neurological signals from the frontal part of the human head could be utilized to control and navigate a computer information system. We have developed a solution called NUOS, the Neural Operating System. In this example of a NUOS user interface, we use a versatile set of interactive tiles for that patient to communicate in various ways. For instance, the patient may indicate that he or she is in pain and further indicate what kind of pain it is. We do so by using EEG, electroencephalography, and EOG, electrooculography. We bring those into a set of algorithms and define what we call fusion. We seek for a very specific signature in those neurological signals for us to control what we call the radar. The radar itself navigating the interactive tile as previously mentioned. It is my pleasure to introduce to you Mr. Henry Evans. Henry is a Stanford MBA. He's also a past CFO in Silicon Valley. He's a 3 times TEDx speaker and also a representative to the US Congress. And he's also a stroke victim at the prime age of 40. Let me show you what Henry and NUOS can do together.
So go to Alexa, the first one, to let's play the music, to go to the music, number 1.
Alexa, play some top 40.
Top 40 from Spotify.
Wow. Amazing. Amazing.
Sending emergency messages.
Wow.
Here
I am
Henry
happy.
is interacting with the radar to communicate daily routine messages.
I am hungry.
And you can also custom type.
Go to Alexa.
Alexa, hi.
Hi there.
Wow. to Alexa. Yeah.
I remember the days when he came out of the coma and he would count the dots on the ceiling and they became his friends. And we laugh about it, but it's not funny because you are literally a prisoner in your body. What's so important here is the independence that he's doing it himself. It's the dignity of the human being that is being brought here that is so huge. You can't take that away from a human being. You can't. It is absolutely huge that he's able to do that on his own. No help.
Awesome.
Thank you. You're welcome.
As you can see, Neuro is able to assist not only the patient, but also a loved one, and also a doctor, a nurse, a professional caregiver. We aim to make Neuro as affordable as possible. This price here on a monthly subscription basis represents actually a total addressable market of over $10 billion worldwide. We are seeking specific reimbursement codes in various jurisdictions around the world to again bring Neuro technology to the people and their family that need this type of communication and computing. We believe that Neuro can assist in acute care, such as stroke, traumatic brain injury, locked-in syndrome, ICU, post-operation, tracheotomy, and so on, as well as rehabilitation and home-based care. We're very excited to be partnering very soon with the Mount Sinai Health System in New York City. Our goal in this process is to define the efficacy and efficiency of the communication created using Neuro between patients and doctors, as well as looking at the advantage of Neuro for neuroplasticity, as well as improvement in rehabilitation, and also cost savings due to the depth and speed of this new method of communication that does not exist previously. Our team is composed of 5 key individuals. I am the founder and CEO. I have been in tech for 24 years. I've built organizations from $0 to $20 million globally, and I'm also an ex-Google senior OEM partner. Abhinav Kumar, also a co-founder and amazing CTO, is a IIT Bombay graduate and an expert in human-computer interaction and brain control interfacing. Pascal has been a senior executive in the medical device industry for 30 years. He's been VP EMEA and VP Global of Hewlett-Packard Medical, Philips Healthcare, GE Healthcare, Welch Allyn, and Hiram. Chris is our Chief AI Officer. He's a data expert for the Government of Canada, as well as the Canadian Armed Forces Health Services. And Julia is our CFO. She is a certified global management accountant with expertise in private and public companies in the United States, Canada, as well as Europe. We are supported by an outstanding advisory board. From Dr. Simon Ovarduran of MIT and Berkeley, to Dr. David Kopfer from Yale and the National Academy of Medicine, and much more. We have experts that are board certified in neurology, clinical psychiatry, military medicine, and more. Our IP is composed of various patents, both provisional and non-provisional, and we are a sponsored company globally by Norton Rose Fulbright since 2016. It's been an amazing year for us. We started with Google, backing us with a $100,000 grant, and winning 2 MIT competitions for the future of healthcare hacking, and also the MIT Barracuda Bowl across all healthcare categories. We're in the midst of this IRB with the Mount Sinai Health System and also determinations from Health Canada and the FDA. We will be focusing on those clinical trials both in the United States and Canada for 2018, followed by commercialization in Canada and the United States next year, and then Europe. I'm excited to announce that we are raising $2.7 million for commercialization, as well as our profitability within the next 2 years. Thank you very much for your time. I look forward to speaking with you outside. Thank you.